This is Shahzad Ahmad presenting the first video in the series of ECG lectures, and this video is meant for introduction to basic concepts in the interpretation of ECG. Shown here is the tracing which is seen in a single cardiac cycle. We can see here various waves as well as segments and intervals. Waves are the vertical deflections from baseline in the ECG tracing. A segment is the time or the duration during two waves, whereas any interval in the ECG always includes one or more than one waves. The first wave during cardiac cycle is the P wave, which deflects atrial depolarization. It is followed by PR segment, and then is the QRS complex, which reflects ventricular depolarization. Between the QRS and the T wave, there is the ST segment. T wave is usually the last wave seen in a cardiac cycle during a normal ECG, and it reflects ventricular repolarization. PR interval is the time or the duration starting from the beginning of P wave and ending at the junction of PR segment with the QRS complex. Or simply we can say that it is the interval from the beginning of P wave to the beginning of QRS complex. QT interval spans from the beginning of QRS complex to the end of T wave. During ECG tracing, in some patients, another extra wave is noted after the T wave, which is a small deflection termed as U wave. Its significance will be discussed later in this lecture or the coming lectures on the ECG. The steps of ECG evaluation include: the first step is patient name. We have to relate each ECG tracing with the patient, whether the patient we are seeing and considering has the same ECG which we are being presented, and then we have to see the date and time of ECG tracing. Its importance is that if the tracing was taken before the start of some symptoms, then it may not indicate or reflect the change in the status of the patient. And then comes the calibration, which means that we have to see that the voltage and the paper speed is normal. Then we will evaluate the rhythm, whether it is regular or irregular. After that, we will check for heart rate, and then we will see for the axis, and then we will evaluate the waves as well as the segments one by one, starting from P wave, then the PR interval, then PR segment, then the QRS complex including its width as well as amplitude, then the ST segment, then T wave, QT interval, and at the end we will look for some extra waves including U waves and J waves. There are a total of 12 ECG leads. 6 are the limb leads and 6 are chest leads. Depicted in this picture are the 6 limb leads. Of the 6 limb leads, 3 are the bipolar limb leads and 3 are the unipolar limb leads. The bipolar limb leads are denoted as lead 1, 2 and 3, and as the name indicates, bipolar means that these leads have a direction, a negative point and a positive point. Lead 1 is directed from right arm to left arm. Its positive pole is at left arm. Lead 2 is directed from right arm to left foot and its positive pole is at left foot. Lead 3 is directed from left arm to left foot and its positive pole is also located on left foot. The unipolar limb leads are lead AVR, AVL and AVF. AVR is located at right arm, AVL is located at left arm and AVF is located at left foot. There are usually 6 chest leads. In some cases, just like when we suspect right ventricular infarction or posterior wall myocardial infarction, there are some additional leads. For example, if we have to see the right ventricular infarction, then the position of the leads is reversed from left to right, and this is called right-sided ECG. And when we want to see the posterior wall electrical activity, then 3 additional leads are applied in addition to the usual 6 chest leads, and these are V7, V8 and V9. So here we will only discuss the normally placed 6 chest leads. All the chest leads are positioned in 4th and 5th intercostal spaces. Normally, V1 is located in 4th intercostal space on the right side of the sternum. V2 is placed in the 4th intercostal space on the left side of the sternum. V3 is usually between V2 and V4. V4 is placed in left 5th intercostal space in mid-clavicular line. Lead V5 is placed in left 5th intercostal space anterior axillary line, and V6 is placed in the same horizontal plane as V4 and V5 but in mid-axillary line. The normal tracing parameters include the paper speed, which is set at 25 mm per second, and the voltage should be set at 10 mm per millivolt. It's very important to evaluate these 2 factors before evaluating the rest of the ECG, because if there was a change in the machine settings in these 2 parameters, we have to adjust our analysis according to these parameters. So shown here is a complete 12 lead ECG along with a rhythm strip of lead 2. At the extreme right, you can see a box which is called as calibration signal. It indicates the paper speed as well as the voltage. So this is the basic concept of the ECG. Thank you very much.